Good morning. I must say I smiled, actually, Mike, when you started talking about MIMIT and NWE Health, because I think of my last few months at MSP, it's taken me most of that time just to get my head around the acronyms. This is a world of acronyms, masks and MIMITs and MACs. And we've got a few more, and I'll come to this chap in a minute. Yes, I am the Chief Executive of Manchester Science Park. I'm also a Director of Bruntwood. My own roots in Manchester go very, very deep, although this is my first MIPIN, amazingly. And I mention those roots because I have to say I'm an absolutely fully paid up member of the Manchester way of doing business and its habit of partnership and collaboration and always seeing the bigger picture in pursuing its opportunities. I'll come back to that at the end if I may. I hope you've noticed this stand design and admired it today. This first slide here is actually the molecular explanation of what you see in that glass. It does boil over from time to time, by the way. but I believe it's not toxic. And I bet it's one of the few stands at MIPIN that wasn't designed at great cost by a marketing agency. It was, in fact, designed by a molecular biologist, a scientist and businessman based at MSP who knows that science is beautiful, and who wants to shout about what he does, and who responds in about 5 minutes to a casual email saying, anybody got any thoughts about what would make a good centerpiece for a stand design at MIPIN? That's the kind of creativity that we have in the businesses at MSP. There's a little card on the stand, by the way, which tells you what that is. But I'll dare to try to summarize it briefly. It's a rogue or a non-natural protein. And it's one, I'm looking at a scientist over there, actually, so I'm not going to go too deeply into this explanation. Suffice to say, it's going to form the foundation for a new breed of medicines, easy to digest, that are workable and effective over a very broad range of diseases. Why have I started these few minutes with a bow to Dr. Khan's protein business? 2 reasons. The first, as both Mike and Howard have said, that he is one of the innovators who is driving the fast increasing contribution of life sciences to our economy. This is a sector that is growing fast, steadily, unhindered by 4 years of economic recession. Across the Northwest, we see 8.6 per annum growth in the number of companies active in this sector in each of the last 10 years. Within Greater Manchester, 65% of all Northwest company investment over the last 2 years has been in this sector. 24% growth in employment in medtech and health. These are impressive statistics by any measure, and so too are the statistics of the knowledge base that sustains them. In the Northwest, there are, I can never quite believe this number, there are apparently 24,000 graduates in science and technology each year. The NHS in the Northwest, and I do believe this figure, spends over £2 billion per annum a year and £300 million per annum on capital investment. The region has 2 of the largest teaching hospitals in Europe, and it has Europe's largest children's hospital. In short, there are very many reasons to be positive and ambitious for the future growth of business in this sector. And reason enough, if you like, for Bruntwood to decide to invest in MSP, an investment that was a little less than a year ago. MSP is a partnership company in every sense of the word. As you can see on that slide, the partners in our business are absolutely aligned to its focus. The 2 major universities collectively making up the biggest single academic campus in Europe. The city councils of Manchester and Salford, these are our shareholders. We also work in partnership, an increasingly close partnership, with the Central Manchester Hospitals Trust, and they are another pivotal, ambitious, very driven community at the edge of the city in the strip that's known as the Corridor. Bruntwood has been involved with the Corridor since its inception, really, and we have always seen that this is the most knowledge-rich, opportunity-laden strip of land outside the southeast of England. 55,000 people work along its square mile or so, 70,000 students, and rising 43% of economic activity in the corridor in knowledge-intensive sectors, over twice the national average. The corridor generates 22% of the city's GVA today, And this contribution, which is about 2.8 million today, is forecast to double in the years to 2020. MSP sits right at the heart of this knowledge-intensive quarter, and when we invested a year ago, it was already one of the most highly respected and longest established science parks in the UK. Locationally, it's absolutely perfect. Engagement between healthcare providers, the university, industry, the city council is facilitated by proximity. Engagement minimises risk and improves outcomes. It reduces development pathways, encourages innovation, reduces failure rates, increases efficiency and speed to market. The innovation ecosystem which the corridor partners are creating works through the relationships that we have forged, so that MSP-based businesses have immediate access to skills, to commercial opportunity, to R&D, and a pipeline of business opportunity which flows from the labs of the universities and the clinical needs of the trust. We, MSP, are part of the chain that commercializes knowledge-driven innovation. We nurture our businesses through a whole range of enterprise support services, ranging from masterclasses, workshops, networking, peer group challenges, mentoring, mutual support on all of the subjects that you would expect a relatively new business to want access to. What we already do is good and it's effective. Business survival rates are way ahead of the national averages, and customer retention at MSP is exceptional. The maturity of our relationships is also the springboard for further development. Mike mentioned the RGF4 bid that we're involved in at the moment. We're bidding for funds that will support the development of that innovation ecosystem further, that will accelerate business formation from our university graduates, and will accelerate growth of existing SMEs by giving them easier access to the knowledge and skills that sit within the university base. I said earlier that there are two reasons for starting with the inestimable Dr. Khan. Here's the second. The innovative small businesses which are spearheading economic growth, and I would include the tech sector in that as well, by the way, want different things from their landlord. This is not the peacock of property supply, but true partnering in creating workman-like spaces where these businesses can co-create, communicate, and navigate the perilous journey to commercial viability. What they want is support from their property partner and then to be left to get on with it. But there is a property dimension, thank goodness. I'm very fond of saying that MSP's buildings at the moment are really rather dull. In fact, MSP at the moment, if you come on site, is a rather beautiful car park surrounded by some awesomely dull buildings. The site will double in size over the next few years. And we will be, by year 6 or so, at about 1.5 million square feet of mixed workspace, lab, and manufacturing and workbench capacity. We're designing the first new build right now, 60,000 or so square feet, and we're already close to having the major pre-let that will trigger a start on site and allow us to create a true heart for the park. The facilities we build will be built around the principle of flexibility. We will introduce the concept of communal laboratory space and the concept of communal workspace and manufacturing and workbench space as well. That combination of facilities will work for businesses that have 1 or 2 people and are straight out the lab, and it will work for multinationals as well and create the symbiosis that will allow us to grow this sector as a whole. There'll be a lot of open space as well. And as anybody who's listened to me talk about the design process that we're in the middle of recently will know, I go straight from 60,000 square feet to talking about the potting shed and the greenhouse and the allotment that we're going to have on site as well, because that actually is in the mix of things that these businesses want us to provide for them. Am I in the right place for my slides? The extension to the park wouldn't... I'm not sure that I am. Sorry, can I just sleep forward a minute? I've lost a slide. It doesn't matter. It's a rather nice building. The extension to the park will not complete to 2015, but actually the side I haven't got is the City Lab project, which I think was showcased to last year's conference, and is 100,000 square feet of biohealth hub. It's based right on the clinical campus within Central Manchester Hospitals Trust. It's a partnership project with the Trust, and it will provide accommodation for leading-edge medtech companies who need intensive interaction with clinicians to develop and to validate their products. This building is already almost fully let, and the stream of inquiries that we're getting then daily now gives us a lot of confidence that City Lab 2 will not be far behind. And we're also expanding the laboratory space, the MedTech Centre, which sits on MSP and effectively acts as a feeder into City Lab. As I said, that will complete in 2015 to meet customer need. No, don't do that. That was City Lab, I think. To meet customer need in the nearer term, we're doing a major refurbishment of one of our existing buildings, one of those very unexciting buildings, but we're working with Sheila Bird, and they are designers who understand absolutely how to put occupiers at the heart of design. The result will be flexible, quirky, practical, and above all, it will be human space, which will work for customers showcasing their products and investor pitches, and using our Cisco NBI equipment will work for them networking, for drop-down space and events as well. That will be ready in about 3 months from now. 2 thoughts I would like to leave you with. I've talked about MSP and I've talked about the corridor. This sector and the opportunities in this sector are much bigger than any one of us. And I come back to the Manchester habit of partnership. We will do best if we collaborate across sites and within institutions, and we collaborate with the objective of growing the cake. Because by growing the cake, we have the opportunity to catapult Manchester into the front rank of cities working in health sciences today. And that should unify our individual efforts. And my final thought is that, my last acquaintance with science was a Bunsen burner when I was 13 and I was asked to draw one. No artist me. I have been so blown away by working with these businesses down on the park for the last 6 months. And if any of you still think that science is all about boring lab coats and people with pointy heads, come and see us, or even better, come back at 3:30 this afternoon and you can listen to the beautiful and inestimable Dr. Brian Cox instead. Thank you.